I
We are
propose
ready.
begin. Okay.
Dr. Opere in as a participant.
He's in as a is in as an attendee. Okay. So, Madam President, are you ready? Let's see the whole team. Okay.
1 second.
Okay.
Thank you, Dofan.
All right. We will begin. So, ladies and gentlemen of the press, thank you very much for joining us this afternoon. This is one of the first times that we are doing a press statement through this platform, but you'll understand that based on the exigencies of the times, we have had to try and innovate in order to ensure that we still get work done even as we continue being restricted in our movement. So today we are here to give an update to Kenyans and to you on the status of the COVID-19 response, and basically around two issues that we think are important and need to be given due consideration. About 2 months ago, the Kenya Medical Association formed a COVID-19 response advisory committee, which has been meeting every week to review the situation and to get expert guidance on the table and to distribute and disseminate that as necessary. And as we have observed the events going on with our involvement, supporting government and supporting Kenyans in these difficult times, there are certain things that we thought we need to make observations on. Today, KMA is represented here by the President, Dr. Jacqueline Kitulu, who will read the statement, the CEO, Dr. Elizabeth Gitau, who is here, Dr. Joy Mugambi, the Assistant Secretary General, Dr. Simon Kigondu, the Secretary General, and Dr. Super Tunje, who is the Treasurer General. I now welcome Madam President to read the statement, and then we will take questions after that. Thank you.
Good afternoon, everyone, and thank you very much, Professor Lukoe, for that introduction. Good afternoon, ladies and gentlemen of the press and all who are joining us. So I will go ahead and read the KMA COVID Response Advisory Committee meeting resolutions from our 9th meeting held on 13th May. So on proposal number 1 is on proposal to ease movement restrictions across the country. So the Kenya Medical Association notes the ongoing discussions around when the current movement restrictions can be safely lifted or eased. So we as the Kenya Medical Association observe as follows. 1, it appears that the decision to impose the movement restrictions in parts of the country have not been based on any health or scientific consideration, which, as we have indicated before, would entail proper community entry, testing, massive testing within those areas, and development of a strategy for containing the infection effectively. 2, to this day, the amount of testing in the restricted areas and in the rest of the country has remained significantly below what is expected of a country of our size and means, even compared to the neighboring countries. As a result of this limited testing, we are operating in the dark, and we currently know neither the real extent of the pandemic in the country nor the trajectory of its spread. So having therefore had no scientific rationale or preparation before the strict movement restrictions were imposed in sections of the country, and not knowing the extent of the pandemic across the country at the moment, it's difficult to understand the rationale for the discussion on easing or ending the movement restrictions. Having made these observations, the Kenya Medical Association now recommends that any decision on enhancing or easing movement restrictions must be based on evidence, which evidence entails doing sufficient testing in order to understand the spread of this disease in the country. In considering ease of travel restrictions, the following conditions must be met. Widespread testing, the number of new cases must be shown to be declining or zero for up to 2 weeks. There must be a reliable national network for contact tracing, quarantine and isolation that is free of coercion and encourages people to cooperate should they meet the criteria for these covering the whole country. Frontline workers must be in sufficient numbers and sufficiently prepared and motivated to handle any surge in cases should it happen. So in the absence of data and without the above criteria having been met, we consider any discussions on easing of movement restrictions and reopening sectors of the economy to be premature and potentially disastrous. On the issue of county preparedness for COVID-19 response, the Kenya Medical Association notes that counties should be on the forefront of the COVID-19 response. We, however, fear that this is not the case in many of the counties, with delayed or absent hiring of additional health workers and shortages of supplies. We recommend that information be provided urgently on the state of preparedness of all counties and that steps be taken to speedily hire additional staff and procure the necessary supplies to enable the country to deal with this pandemic. The committee will meet again on Wednesday, 20th May to review the situation and issue further guidance and recommendations. Thank you.
Thank you very much, Madam President. We will take some questions for purposes of clarification and any further information that may be required. I think for those who are here, the journalists, you can just raise your hand and then we will allow you to speak. Okay. I'm not seeing anybody with a raised hand. All right, Elizabeth.
I'll raise my hand.
Yeah, okay, you can speak.
Okay, thank you. Probably a question that I'd like an answer to is what we've observed globally with the ease of these restrictions. Now that COVID is, WHO says that COVID is here to stay with us. You've rightly mentioned that testing is low, and most of the restrictions on movement have been largely not informed by scientific evidence. So how then do we move on? Are we even moving on to begin with? Because from the look of things, the numbers are low compared to the projections that had been put out last month. And now we are talking about joining the world in reopening our country. Is this the way to go for us? Yet we're in a flu season.
All right, Meral, thank you very much for that question. And I think you've asked, looking at other countries, what has worked. One of the countries actually we can look at is a very close neighbor, Uganda, that actually, and Rwanda, who have imposed quite stringent restrictions on travel and movement. And you can look at their numbers, they have a lot to tell. The strict measures, difficult as they have been to the public, have borne fruit. Their numbers have been low. Their deaths in Uganda, actually, they have 0 deaths. And when they plan to open up and ease restrictions, it is based on the fact that despite continued testing, the numbers are not increasing. Now, if we're looking at other countries as well, even the Europes, the US, there's no country that says that they're doing adequate testing. So all of us are struggling in the area of testing because the commodities to test are in short supply globally. However, to make valid decisions based on trajectories and trends, you do need numbers. So the testing needs to be done. And yes, the idea that the country has gone the direction of targeted expanded testing in areas that are hotspots. That is one of the ways when you're short of supply, that you can't then just test the whole country, but you can target the areas that are hot points, and like which they did at the borders amongst the truck drivers in certain areas which have been closed off, but then that increases the knowledge with which you can work. So, and that goes back to what we are saying in our statement, that until we are doing adequate testing in numbers that can give you valid data to make decisions, then it is a bit premature for us to say that we are going to open up the economy. All the people that have eased restrictions and are opening up has been consistently based on the fact that their numbers, when they have tested, are going down, declining, or have been next to zero. One of the countries, Northern Cyprus, is one of them. The last 3 weeks, they have 0 infections. They are easing, opening up the economy. And we can understand that. So that is the caution with which we need to also look at our easing of the economy, opening up of the economy.
Okay. Thank you very much. Any other questions?
Prof, there is a question from Facebook. Someone is asking, Faith Mungai is asking, what's the state of testing for healthcare workers, prisoners, law enforcement officers?
Okay.
Okay, so the state of testing. So in terms of categorizing the priority areas, those that have been categorized as priority indeed are healthcare workers, because of course they're exposed to many patients in a day. They may be, they can be the ones who would actually transmit infection. So those have been prioritized, and the priority testing has been started in the facilities that are actually had to treat COVID patients. So that we have a massive testing went on Kenyatta, Mbagathi, moving on to KUTRH, and KUTRH. Now, of course, the other hospitals at the Coast General Hospital, which has been one of the target hospitals. So again, that's an area of targeting. And then now the next level is how do we expand that to other facilities, and what is the frequency of testing depending on the state of contact with possible patients. Now, the others that have been prioritized for testing, of course, is also the, other than the frontline healthcare workers, is the truck drivers. The others have also been the facilities. Remember that we have very many quarantine facilities which have been schools and hotels. That's another area that was prioritized, because then they're in the places where people are in contact with possible patients who would have COVID. So the staging, and then now the next is in terms of looking at the target areas where, and that's where you've seen there was massive testing in Kawangware, in Isli, in Mombasa, in Old Town, looking at the areas where the numbers have been high. And it will be a process that requires constantly renewing and reviewing, bearing in mind that we are short of commodities, and that's not unique to us, but with what we have, we should get the best results out of those resources, rather than just testing everyone and not prioritizing those who are at higher risk.
Okay. Question? That is Sheila Njeru. Okay. Sheila Njeru, you're able to speak? Okay, then I think she's having trouble getting her audio. Let's get somebody else. Winnie. Winnie Kamau. All right, so she's also not able to speak. Good. I'm seeing.
I have raise your hand on my.
Yeah. Oh, Nasibo.
Yeah,
Please,
I don't have
please go ahead.
hand.
Yeah, go ahead.
Okay, so this might not have to, the question doesn't have to do entirely with the topic, but the president has said severally that we have a global shortage of, in terms of testing reagents and all that. But maybe from your experience throughout this past 2 months, I mean, how, I just want to know how Kenya has failed in securing testing kits, that we are falling so far back. Even Uganda is doing 3,000. The most we've done is 2,000 yesterday, and most of our kits we rely on donors for the kits. We've got a majority of the kits that we have acquired donor. So I don't know, Dr. Kitula, with the PS, I don't know if you might be in the position to answer what is the issue. Why don't we have? Yes, there's a global shortage, but what is the problem?
I think.
Thank you, Nasibo.
Yeah, I think I will point out that question, and the proper people to answer it would probably be the Cabinet Secretary for Health, who can give you details about the bottlenecks they are facing and whatever it is that is informing the difficulties in accessing kits and so on. We can only speak about what they tell us, but then I think it is better for you to direct it to the Principal Secretary and the Cabinet Secretary of Health.
Perfect, thank you.
Yeah.
I have another question, if there isn't someone else on the line. So with regards to deaths, I don't know if one of you can talk about this, but we have seen handling of bodies and burials while being carried out by public health officials, or rather the health officials who've been designated to conduct this service. Yeah, the public has there has been an outcry on how the government has been doing the burials. You've seen the Bomet case, where the person was buried at night. Same to the CIA case. And I think this is fueling stigma and trauma among the public. And one of the reasons why people are not coming out for testing. So I've seen that the ministry has issued an interim infection prevention control on how to handle human remains. But socially and morally, are they really doing it right? Because at the end of the day, you really need to accord respect to the dead.
Yeah, I think you've hit the nail on the head, Merab, that everybody
Okay, Professor, seems like we're losing you.
Oh, my connection was a bit unstable. Am I back?
Yeah.
Okay. Yeah, thank you, Elizabeth. The question you raise and the points you raise are very important, in the sense that all of us agree, and the KMA has also endorsed the idea that we must treat our dead with respect, no matter what they die from. So every effort must be made to accord the necessary dignity and respect to those that die from COVID-19, and to allow, as far as is possible, the family's wishes on how the burial should be conducted to be respected within the bounds of public health, where we are saying they should be buried as fast as possible within 48 hours, and that there shouldn't be large funerals and so on. As long as people are able to observe that, we shouldn't engage in a process that then increases stigma, for instance, rushing to bury people at night and so on and so forth. So as far as possible, we are encouraging our public health officials to accord the necessary dignity to the family, to as far as possible involve the family in the funeral arrangements within those 48 hours, so that they choose who should attend, who should be present, they choose what rituals they should perform as far as is possible and as far as it's safe, but then without treating the dead as if they are things that are just being thrown away. We must continue to treat people with respect and with dignity. according to the WHO recommendations and the Ministry of Health's own guidelines.
I think as I pipe in there, I think, Merab, a lot of some of the things that have happened have been due to the steep learning curve. I think this is a new area, an area where everyone was approaching it from a point of fear. And I think that's the normal human response. But that has to bear in mind that, yes, life is going to go on and there'll be many other situations going on, and we must learn to deal with the situation. So part of the mitigating issues is also in terms of just training even those who are going to deal with the dead who have died from COVID, and knowing, you know, what is a safe practice and what can be done. So I think from the trainings that are ongoing, and there's a special training that has been set aside specifically on dealing with the handling of human remains, so that it's at all levels, even in terms of the mortuary attendants, in terms of the pathologists, and therefore the result of, therefore the effect on the families of the deceased. So I think a lot of the actions, and in many areas, and it's not just in dealing with the dead, even it's in the issue of dealing with quarantine facilities, in the issue of the treatment, that point of lack of information or of uncertainty has led to quite to some situations that are really undeserved. And as we said, then our mission is to ensure that we are all adequately informed, not only as the medical personnel, but also as the public, and in terms of ensuring that at always, whatever is done in a humane manner and with respect and with dignity.
Right.
Thank you.
Thank you very much, Elizabeth. If there's no other, I think what we will say in closing is that we just reiterate the need for this testing to be ramped up so that we are at par with what our neighbors are doing at least, and so that we get a clearer picture of this pandemic before we can make decisions about which areas need to be closed up and which areas need to be opened up. And areas that we have already closed up, like Isli, Mji Wakale, and so on, we should be able to test a lot more people in there so that we get an idea about the true magnitude of this problem. And if we do that, then we will have sufficient information on which to base decisions about opening up the cities or the country or restricting certain areas. And the second point which we want to re-emphasize is that our counties are not ready to handle this pandemic if it indeed erupts in those counties. They are struggling, and it is time for us to get a true report on the state of preparedness of the counties in handling this. And without this information, we are not ready for any potential surge that might come in case we ease the restrictions and allow people to move more freely. So those 2 points are what we wanted to emphasize today, and we thank all of you for coming for this press conference. Thank you very much.
Thank you.